Welcome to Medicine with Dr. Moran. Does not getting vaccinated for COVID make you an unsafe driver? Should your insurance premiums go up or down because of vaccine status? These questions are being asked because a new study from the American Journal of Medicine. I'm going to review the study briefly and point out the relevant details. This past week, researchers at Sunnybrook Hospital in Toronto released a study finding that unvaccinated people are more likely to end up in a motor vehicle accident than vaccinated people. Here is their abstract. There's a link in the description below to the study. Now, they postulated that vaccine hesitancy is actually a reflection of psychology that might also contribute to traffic safety. This was an observational study only, meaning that there was no randomization between the two groups. In other words, those that were vaccinated and those that weren't. Randomization is where we put a group of people together, similar people, for a study, and they are randomly placed without the investigators or the test subjects knowing into an intervention or treatment arm versus being placed into a placebo or controlled arm. That way both groups would be similar, and you could tell what the intervention or treatment does to the two similar groups of people. Now, what these researchers did was they looked back retrospectively at a total of just over 11 million individuals. 16% didn't get vaccinated and 84% did receive the COVID vaccine. Then they looked at traffic accidents, and in total there were 6,682 crashes, which included pedestrian accidents. They found that the 16% who were not vaccinated accounted for 25% of the traffic crashes, which was an increase, a 72% relative risk increase. In their conclusion, they wrote that the data suggests that vaccine hesitancy is associated with a significantly increased risk of a traffic crash, and that an awareness of these risks might help encourage more COVID vaccination. They suggested, and I quote, primary care physicians who wish to help patients avoid becoming traffic statistics, for example, could take the opportunity to stress standard safety reminders such as wearing a seatbelt, obeying speed limits, and never driving drunk. The observed risks might also justify changes to driver insurance policies in the future. In addition, they go on to state that the findings suggest that the unvaccinated adults need to be careful indoors with other people and outside with surrounding traffic. 39% of the traffic accidents involved pedestrians, and they found that there was a 38% increase in relative risk if you were not vaccinated. So if you look at the pedestrian accidents, there were 38% more in the unvaccinated group. Now, there are numerous problems with this observational study, and the most obvious is the fact that these two groups are markedly different from each other, not just the fact about vaccination status. Now, here's the patient characteristics from the two groups. And as you can see from the chart, the unvaccinated people were far more likely to be younger and have lower socioeconomic status. When we compare groups, we want to make sure that they're both very similar. That's why I talked about randomization. While they tried to correct, of course, for some variables, it would be absolutely impossible to correct for the numbers of miles driven and a number of other factors, including location, weather, driving speed, or spacing between cars, as well as correction for the number of miles walked if you're talking about pedestrians. Now, younger people and people of lower socioeconomic status are much more likely to drive more and longer, and so accidents could be more common in that population. And many wealthy people with higher vaccination rates actually work from home during the pandemic. The study authors do point out numerous limitations of their study, including the factors I've just noted, and they do correctly point out that an association of unvaccinated and traffic accidents does not mean that one causes the other. Now, obviously, receiving a vaccine does not make you a better driver. This study received a lot of media attention, but I think for the wrong reasons. I do not think that this study is particularly helpful. Many people are going to find the study discriminatory and harmful, and if this information is leveraged, it could further increase vaccine hesitancy and create more animosity towards public health officials, physicians, and government. And imagine the insurance CEOs drooling after this study. This is exactly why we need randomized clinical trials, and it's something that physicians have been requesting repeatedly through the pandemic, the lack of randomized trials and the lack of research money devoted to COVID. I previously made a video on what the National Institutes of Health in the United States spent on COVID. It certainly wasn't enough. Now, some examples of what they didn't do, but what was desperately needed, was not studying proper randomized trials on masking, what natural immunity protection gives you, a proper study randomized on bivalent vaccines, and prospective studies of vaccine complications. Not to mention a study of Paxlovid, which is the antiviral that we're using now to treat COVID in vaccinated people. It was studied in a small sample in the unvaccinated, but we're giving this medication out to lots of people, and we don't truly know which groups are actually benefiting from this expensive treatment. These are the studies that it would have been nice for any country to do. It would give us a better idea on how to navigate our way through this pandemic, making proper medical decisions that balance the risk and the benefits. I appreciate you watching till the end today. And remember, get healthy and stay healthy. That's the most important thing about trying to make your body resilient to disease.